This video will explain some commonly asked questions for the primary FRCA VIVA. It will cover 30 topics. Each question will be followed by a 10-second pause. Describe the paediatric airway. Draw and label a transverse section of the spinal cord. Describe how you would manage a period of intraoperative hypotension. Define and classify cyanosis. Explain how you would manage a needle stick injury. Describe the terms tolerance, addiction and dependence. Describe and explain the physiological changes during pregnancy. Explain how you would manage a period of ST changes during intraoperative care. Describe and explain how we can reduce intracranial pressure. Describe the cardiac circulation from an arterial perspective. Describe the fetal circulation. Describe the anatomy of the sciatic nerve. Define and classify diabetes perioperative management. Explain how you would manage an episode of laryngospasm. Describe the arterial blood supply to the spinal cord. Describe common contraindications to regional anaesthetic techniques. Describe and draw the femoral nerve. Describe the complications of blood transfusion. Describe the signs and management of anaphylaxis. Describe the risk factors relating to anaesthetic awareness. Define and explain how you predict a difficult intubation. Define Henry and Graham's laws. Define and classify antepartum hemorrhage. Draw and explain the classic coagulation pathway. Define and explain how you'd manage an episode of intraoperative bradycardia. Define and explain management for failure to breathe post-operatively. How would you manage an episode of high spinal block? Describe the anatomy of the epidural space. Describe and classify spinal needles. How can we measure the volatile anesthetic concentration? Explain and describe the cerebral circulation. Please like and subscribe if you like our content.